If you feel chest pain, take an aspirin. Maybe you've heard that from a friend, seen it online, or even had it recommended by a healthcare provider years ago. This phrase became famous, simple, direct, and seemingly life-saving. But is it still safe in every situation? What many people don't know is that this advice, repeated as an absolute truth, can actually be dangerous. In some cases, aspirin helps. In others, it makes things worse. In this video, you'll find out when it truly saves lives, and when taking it without proper guidance can come at a high cost. In life's most critical moments, the worst thing we can do is act in the dark, especially when it comes to heart health. Thousands of people have cardiac risk factors, take medications daily, or live with someone who may suffer a heart attack. And yet, many still make decisions based on random advice, viral videos, or outdated recommendations that no longer apply. This video is for those seeking clarity, safety, and responsibility. Here, you'll understand what science really says about using aspirin in emergencies, who can benefit from it, and most importantly, when it can actually be risky. This isn't about fear. It's about being prepared. Aspirin isn't a villain or a hero. It's a powerful tool that must be used the right way, at the right time. And that's exactly what we'll show you, step by step. It's a more common scene than it should be. Someone feels chest pain, walks to the cabinet, grabs an aspirin, and swallows it without thinking twice. They believe they're doing the right thing, maybe because they heard somewhere that this is the home protocol for a heart attack. The truth is, in that moment, they might be putting their life at risk, and they don't even know it. Self-medication is a deeply rooted habit in our culture. Many people grew up believing a pill can fix anything. With aspirin, the risk is even higher. It's sold over the counter, it's cheap, and it has the reputation of being a life-saving drug. That creates a false sense of safety. But here's the problem. Aspirin works by inhibiting platelet aggregation. In other words, it helps prevent blood clots. In the right kind of heart attack, that's helpful. But in other situations, it can cause severe bleeding, especially in people already taking anticoagulants or those with gastrointestinal issues. And not all chest pain is a heart attack. It could be anxiety, acid reflux, muscle inflammation, or even the early signs of a stroke, where aspirin is absolutely contraindicated. In those cases, what was meant to help actually makes things worse. We're facing a silent crisis. The overconfidence in the right pill at the wrong time. Well-meaning people, often caregivers or older adults, are acting without accurate information, relying on generic advice that doesn't consider their individual conditions. The result? Delayed proper care, worsening clinical outcomes, and in the most tragic cases, lives lost that could have been saved with the right actions. That's why, before making any decision, it's crucial to understand what's behind this seemingly simple pill. And the first step is breaking down the myth that formed around aspirin. The belief that aspirin saves lives during heart emergencies didn't appear out of nowhere. It was built over decades based on real and well-meaning discoveries, but over time, the message got distorted outside its original context. It all began with studies from the 1980s and 1990s, which showed that aspirin, by preventing platelets from clumping together, significantly reduced the risk of death in patients experiencing an acute myocardial infarction. This was a breakthrough in cardiology, and for a while, the recommendation was clear. If a heart attack is suspected and there are no contraindications, aspirin could be given as soon as possible, with medical supervision. But this message ended up getting overly simplified, especially by the media, public health campaigns, and even some healthcare professionals trying to make it easier for the general public to understand. The phrase chest pain? Take an aspirin became popular, and that's when the confusion started. A crucial part of the message was lost. Not all chest pain is a heart attack, and not all heart attacks should be treated with aspirin immediately without evaluation. The clinical context is everything. Heart attacks involving a bleeding risk, people with active ulcers, or those on blood thinners can suffer serious consequences from following that generic advice. The myth grew stronger through stories of celebrities who supposedly saved their lives with aspirin, viral videos teaching people to chew a pill if your heart stops, and outdated advice that never got revised in casual conversations. Today, the result is a misinformed public that reacts by reflex, not by understanding. And when it comes to cardiac emergencies, acting on autopilot can be just as dangerous as not acting at all. Dispelling this myth is the first step toward regaining control in high-risk situations. Next, let's look at what current science actually recommends, and why aspirin must be used more carefully than most people think. Aspirin is not just any medication. When used correctly, especially in the context of an acute myocardial infarction, it can truly help save lives. But this effect is not universal. It depends on a very specific set of factors that evidence-based medicine has studied for decades. Aspirin's main benefit in heart emergencies is its ability to prevent platelets from sticking together, stopping clots from forming or growing inside the coronary arteries. This is critical when a heart attack is caused by a sudden blockage, such as in an ST elevation myocardial infarction, STEMI, the more serious type where a major heart artery is severely blocked. In this scenario, clinical studies have shown that early aspirin use can reduce the risk of death by up to 20%. Especially if taken within the first few hours of symptom onset, and combined with other treatments like angioplasty or thrombolytics. That's why, in hospitals or under medical guidance, it's widely used as part of the initial care protocol. But here's the key point. Taking aspirin before emergency care arrives is only recommended when there's a high suspicion of a heart attack, and no known contraindications. Ideally, this decision should come from emergency services, who can guide the patient or family member over the phone to take the aspirin while help is on the way. Several major medical guidelines, including those from the American Heart Association, AHA, the European Society of Cardiology, ESC, and the Brazilian Society of Cardiology, SBC, are clear. Aspirin must be used with care, not as a go-to solution for any chest pain. Moreover, medical science has evolved. We now know that using aspirin for primary prevention in people who have never had a heart event is much more controversial, and in many cases, it's even discouraged. So here's the bottom line. Aspirin can save lives, but only when used in the right context, for the right person, and at the right time. Using it randomly, even with good intentions, can turn a life-saving medicine into a source of serious complications. Up next, let's take a closer look at who should not use aspirin in emergencies, and why being careful with this decision is more important than most people realize. Who should not take aspirin in emergencies? If aspirin can help in some cases, why is it so risky in others? The answer lies in how it works. Aspirin prevents blood from clotting. In a blocked artery, this can be life-saving. But in many other situations, that same effect can be dangerous, even deadly. One of the main contraindications is for people with a history of ulcers or gastrointestinal bleeding. Aspirin not only reduces the blood's ability to clot, it also irritates the stomach lining and can trigger internal bleeding, sometimes silent, sometimes severe. The risk is even greater in older adults, who often have more fragile gastric walls and may already be taking other stomach-irritating medications like anti-inflammatories. Another high-risk group includes people who already take blood thinners like warfarin, rivaroxaban, or apixaban. The interaction between these drugs and aspirin can dramatically increase the risk of bleeding, including brain hemorrhages. In these cases, taking aspirin during an emergency not only fails to help, it can seriously worsen the outcome. There are also those who are allergic to aspirin or other NSAIDs, non-steroidal anti-inflammatory drugs. For them, taking aspirin can trigger serious reactions like bronchospasm, intense hives, or even anaphylaxis. For people with asthma, this risk is even more significant. One of the most dangerous mistakes? Taking aspirin when the diagnosis is unclear. For example, a sudden headache could be a hemorrhagic stroke, and in that case, aspirin increases the risk of a brain bleed with potentially irreversible consequences. Sadly, many people don't recognize the warning signs and, uncertain of what's happening, decide to just take the pill. Other people who should avoid aspirin include those with severe liver disease, bleeding disorders, or recent excessive alcohol consumption. This is where a key concept comes in. What saves a life in one context could endanger it in another. Aspirin should never be seen as a safe by default drug. It's a powerful medication that requires awareness of your personal history, current condition, and potential risks. Learn to recognize the true warning signs of a heart attack and what to do when they appear before reaching for any medication. How to recognize a heart attack. Signs that require fast action. Recognizing a heart attack early can be the difference between saving a life and losing precious minutes. But not every symptom is obvious, and that's the challenge. Knowing when to act and acting the right way. The classic symptom of a heart attack is chest pain, usually in the center or left side, with a feeling of pressure, tightness, or heaviness, like something is crushing the chest. This pain may radiate to the left arm, neck, jaw, or back and typically lasts more than a few minutes, often accompanied by other alarming symptoms. The most common signs include shortness of breath, even at rest, cold sweat, nausea or vomiting, dizziness or lightheadedness, pale or grayish skin, a strong sense of impending doom. In older adults and women, symptoms may be more subtle and easily confused with other conditions. For instance, there might only be mild chest discomfort, extreme fatigue, or stomach pain. These atypical cases are especially dangerous because they're often dismissed or mistaken for something minor. This is exactly where many people go wrong. They wait to see if it passes, self-medicate, or call family members instead of seeking professional help. Others take aspirin or painkillers thinking it'll be enough, and lose valuable minutes. Experts recommend a clear protocol. If you suspect a heart attack, call emergency services immediately. Describe your symptoms clearly, mention any pre-existing conditions, and follow the dispatcher's instructions. These steps can save lives. Another common mistake is driving yourself to the hospital. During a heart attack, there's a real risk of fainting, arrhythmia, or cardiac arrest. You should always be transported by professionals trained to respond if your condition suddenly worsens. Recognizing the signs of a heart attack doesn't mean diagnosing it. It means understanding the risk and acting quickly. Above all, don't make rushed decisions. Now let's learn when and how aspirin can be used safely, and under what conditions. When and how to use aspirin safely. After recognizing the signs of a heart attack and calling for emergency help, the big question arises. Should I take aspirin now? The answer isn't simple, but it's essential to understand when its use is both safe and effective. First, remember, aspirin should not be used automatically for every kind of chest pain. It should only be taken if you're confident that you're having a heart attack, you have no known contraindications, and preferably after receiving medical advice, even if it's over the phone. In real-world situations, when emergency services are called, by a family member or caregiver, for example, dispatchers may advise taking aspirin while the ambulance is on its way. This recommendation is based on the fact that, in suspected heart attacks without contraindications, the potential benefits outweigh the risks. The usual dose is 160 to 325 milligrams, preferably in chewable tablet form. Chewing the tablet speeds up absorption and action. Never take aspirin in capsule form, as it takes longer to work. To ensure safe use, the person should be alert, fully conscious, and have no signs of allergy or active bleeding. If there's any doubt, it's better to wait for professional medical evaluation. If you have a complex medical history, like aspirin allergy, regular use of blood thinners, ulcers, or liver problems, it's best to have an emergency plan created by your doctor, outlining what to do in a crisis. Also, it's important to distinguish emergency use from preventive use. Taking aspirin daily to prevent future heart attacks is a medical decision that depends on your personal health profile, and shouldn't be confused with taking aspirin during an emergency. To sum up, aspirin can be a powerful ally, but only when used at the right time, in the right dose, and under the right circumstances. Now, what if you're already taking aspirin every day? How does that affect what you should do during a cardiac emergency? What if you already take aspirin every day? Many people at risk for heart problems take daily low-dose aspirin as prescribed by their cardiologist. This is a common strategy to prevent blood clots and reduce the risk of heart attacks or strokes. But what does it mean during an emergency? What if someone is already taking aspirin and starts to experience concerning symptoms? First, it's crucial to understand that daily aspirin use does not eliminate the need for emergency care if you notice signs of a heart attack. That daily dose is part of a long-term treatment plan. It's not a quick fix you can rely on in a crisis. If symptoms appear, the best approach is to inform emergency responders about your regular aspirin use. Often, there's no need for an extra dose, since the medication is already active in your system. Also, people who take aspirin daily should have regular medical follow-ups to assess whether this therapy is still beneficial. Long-term use increases the risk of bleeding, especially in older adults, and should be adjusted based on your clinical history. Never stop taking aspirin on your own. Always talk to your doctor first. And in an emergency, accurate information about your medication use is essential to ensure the safest and most effective medical care. Finally, always have a clear action plan in place, with your cardiologist's guidance, so that if symptoms appear, you can make informed decisions, not rushed ones driven by fear or confusion. Now, let's go over a simple and effective protocol to follow when you suspect a heart attack, so you'll have a clear and safe roadmap to act quickly and confidently. What to do in case of doubt. A simple life-saving protocol. When a heart attack is suspected, uncertainty can take over. You feel pain, but you're not sure if it's serious. Should you take aspirin? Go to the hospital? Wait it out. In moments like these, a clear protocol can make all the difference and help you avoid impulsive decisions that could put your life at risk. First, if you feel strong and persistent chest pain, especially if it's accompanied by cold sweats, shortness of breath, or pain radiating to your arm or jaw, stop what you're doing and sit or lie down in a comfortable position. Don't try to move around too much. Next, call emergency services immediately, SAMU 192 in Brazil. Calmly explain your symptoms and provide as much detail as possible. How long the pain has lasted, its intensity, and whether you have other symptoms like nausea or dizziness. This information is crucial for fast and appropriate medical response. If the operator advises taking aspirin and you have no known contraindications, chew one tablet of 160 to 325 milligrams. Chewing allows for faster absorption than swallowing whole. While you wait for help to arrive, stay calm, breathe slowly, and avoid any physical exertion. Don't take other medications without medical guidance. Never drive yourself to the hospital. The risk of complications along the way is too high. Paramedics are trained to begin treatment and monitor your condition during transport. Finally, remember, acting quickly doesn't mean acting impulsively. Knowledge and emotional control are your greatest allies during a cardiac emergency. Aspirin has a well-established role in medicine and, when used correctly, can be a powerful tool for saving lives in cardiac emergencies. However, it's essential to understand that it's not a miracle solution for all chest pain, and it should never be taken automatically or without proper guidance. More than just a medication, aspirin is a reminder of the importance of knowledge and caution. Knowing when to take it, who should avoid it, and how to act at the first signs of trouble can make the difference between a tragic outcome and a successful recovery. In emergencies, the best course of action isn't the impulsive use of medication. It's the combination of symptom recognition, rapid activation of professional help, and, when appropriate, the thoughtful use of aspirin. Heart care begins with the right information. And now you're better equipped to make conscious decisions that can protect your life and the lives of those you love.